Well, this is my first podcast after the COVID crisis where I was home for 10 weeks. Offices finally reopened. This podcast is going to be on otoplasties or cosmetic ear pinnings. I do quite a few of these. I think a lot of people out there, surgeon-wise, I'll probably only do one a year or one every other year, but I do one either every week, 2 weeks, or sometimes on rare occasions only once a month. So it's something I do quite frequently. Otoplasties or cosmetic ear pinning is really just reducing the amount of protrusion of the ear where it sticks out too far. There are two basic types. There's a lop ear and a cup ear deformity. The lop ear is a condition where the antihelix, which is, if you can Google what that is, the fold of the ear is missing, and so the ear lops forward. And a cup ear is excessive conchal bowl, which is the conchal bowl is the cartilage that's near the ear canal. So the goal of an otoplasty is to reduce the proportional elements of both. And I find that in most patients, they have a certain percentage of both. So almost invariably, I'm working on both of these conditions to differing extents. Some people have much more of a cup issue. Some people have much more of a lop issue. And I combine both to get the right results. I oftentimes actually do one-sided or unilateral otoplasties as well for people just with one side sticking out. The trick with this is I see a lot of results that just look totally unbalanced. In fact, I've published on this before, written chapters on balanced otoplasty. Essentially what that means is that you don't want an ear that's way over pinned back. That just looks really awkward and weird. And you don't want an ear that's compressed in different ways that don't look right. So like if you press the top 2/3 of the ear too far back, the earlobe will stick out too far. It won't look right. You really want to balance and reduce the earlobes as well when there's an indication for that. So I'm not really talking about otoplasties for like birth defects and things like that, or like bad facelifts and things like that. I'm really talking about just ears that stick out too far. A question I get oftentimes is, can I take an ear that's sticking too far and just reduce the size of it? And I would say in most cosmetic cases, no, because when you try to do that, the ear can get distorted. Now, I do and I have reduced many times an ear size, but it's usually due to cancers and things like that where I'm actually doing some sliding flaps, etc. But for cosmetic purposes, it doesn't make a lot of sense. When an ear looks too large, it usually looks too large because it's just sticking out too far. And most people relate to each other socially from the frontal view. So if I can make the ear just brought back a little bit, then the ear just won't look so prominent. So let's talk about understanding how far to pull it back. There's an idea called helical show. And helical show means that from the frontal view, the helix, which is the outer rim of the ear, should not be completely hidden. When that is completely hidden, it is overpinned back. And that is a big issue. The other thing, too, is that when you're looking at priorities, the number one priority for me is that the ears have a relative symmetry when you're looking at them from a frontal view. That's the defining element. In fact, when I'm doing otoplasty, I constantly go back and look at the frontal view to make sure that it's sticking out the right degree, the same degree on both sides. So that's really, really important. I call that the priority number one. In most cases, of course, there's other variations. The other thing that's important is when ears are asymmetric and I pull one ear farther back to try to get the protrusion about the same, the ear that I pin back farther will have a slightly different configuration. Or, for example, either the antihelix is a little bit more protuberant, or the way that the ear is pinned back, the shape is slightly different. Now, these differences really could only be noticed when you're tilting your head back and forth. But after an otoplasty, people always go back and forth and look and try to figure out why one side's better than the other. So what I'm trying to do is get the result where the protrusion is relatively symmetrical. The reason I say relatively is that we can never get the two sides exactly the same. But that's the general goal. So these little changes are very important that you know that. The other thing too is important is with the otoplasty, there can be some relaxation of the ear over time. But what I try to do, and I've actually got this from a German doctor, I think he's probably retired now, but I learned this about 10 years ago. He had developed a little file. And so what I do is that I file down the front of the ear. So how do you do that if your axis is from the back side? So I make a small little incision right inside the helix, inside the curve of the ear on the front. I rasp the front of the cartilage in the front of the ear. What that does is several things. Number one is actually physically weakens the cartilage, so the recoil mechanism is far less, and that's, to me, an important element to this. The other thing it does is that it weakens the side of the cartilage. Your cartilage will bend away from the side that's abraded. So the natural tendency for most otoplasty surgeons is to abrade or weaken the back of the ear, and that's what I used to do when I started this, because the ear is open, the axis is there. It makes a lot of sense to do that. But what I do is I abrade the front of the ear, and by abrading the front of the ear actually has a tendency to want to flop back, and so that actually poses a countervailing force, another an opposing force to the tendency to relax the ear. The same thing I do with the conchal bowl, the cup portion. Again, these anatomic terms are quite difficult to comprehend, but I rasp the front of the bowl through an access point, again, from the back side of the ear. And then I overlap that cartilage to break the recoil and let the ear set back. A lot of people will tie those sutures back to the back of the mastoid bone behind the ear. I find that's very not secure at all. So I could go on for a long time about otoplasties. It's one of my passions, is doing great ears that look natural. In fact, I just recently did a gentleman who came in. The doctor pinned his ear so far back that when he was getting a haircut, he had to hold his ear out of the way so so that the hairstylist could cut his hair. And I said, sir, it makes your head look too big. He goes, I don't care about that. Just go ahead and fix it so that I can cut my hair normally. I'm like, oh my God. I said, can you even wear glasses? No, I can't even wear glasses. I said, look, I want to fix your functional problem, but I also want to help you aesthetically. So I was able to do a lot of different skin grafts from one side back and forth, release the scar tissue. And of course, I did not do his primary otoplasty, but got his ears to the point where he could actually wear them comfortably. I mean, his ears look better. He could actually wear glasses. He could actually get his hair cut without holding his ears out. I think he's on my website as well. He's nice enough to let me do that. His ears are still slightly overpinned, but they're so much better than what they started with. And it's sort of weird that everything is a balance issue, so that by overpinning his ears, the doctor actually made his head look bulbous and weird. So balance is such a huge component to all this. So I'll go to much more detail with you if you decide to do an otoplasty consultation with me, or would like to do an otoplasty with me. But I thought these are some basic tenets of how I do otoplasty.